Hi, I'm Megan Crow, and I am the Executive Director of the Cancer Resource Center. So I came to the Cancer Resource Center in September to take on the Executive Director position. And one of the things that I noticed when I was applying for the job was how comprehensive the website was. And we have so many services here at CRC that people don't realize that we have. So I would encourage anyone that's been diagnosed with cancer to check out our website and look at all the services that we do offer. We also work together with Cornell University, and if you need transportation to the city for a second opinion or for an appointment, we can help make that reservation for you to take the bus free of charge. The Cancer Resource Center actually was incorporated back in 1994 as Ithaca Breast Care Alliance, and a group of 9 women started the organization as a nonprofit. And all these women had been diagnosed with breast cancer and wanted to find a way to help support other women in the area going through a difficult time, to have a network or a circle of support. And that's how the CRC started. And for years, we were known as Ithaca Breast Care Alliance, or IBCA. And in 2007, we changed our name because as the years went on, we started serving more men, not just women, and we also were serving people that were diagnosed with other cancers besides breast cancer. So we changed our name in 2007 to the Cancer Resource Center to better reflect what we are actually doing and the people that we are serving. We have so many volunteer opportunities for people, and a lot of our volunteers have actually been clients. And because they've had such a positive experience or been really impacted or affected by what we've done or the help that we've given them, they've decided to give back. We have a program with the Cayuga Medical Center where we have volunteers that are working in the chemo and radiation departments, and they help the patients with feeling comfortable. They help the nurses who are so busy doing the treatments and care, and they give them snacks, a warm blanket, and they'll sit and talk with them for as long as that person is interested in talking. Where I'm sitting here today is a conference room, a support group meeting room, and also a space for our lending library. So we have all types of books related to cancer or cancer topics. They might be medical, they might be personal stories, educational, but a whole variety of books that our clients can check out at any time. We're very fortunate to have a collaboration with Cornell University, and every semester there are classes that are offered to the students to learn more about cancer-related topics, and it is open to our clients as well as the community. And this is a great way for the students to get a sense of the human side of the disease. Typically the students are in the lab and they're doing the research, but they don't always meet the people that are actually affected. Our clients really enjoy meeting the students that are doing the research, learning more about what's going on in the fields of cancer research, and learning more about their disease.
Hi, my name is Monica Vakiner. I'm the Director of Client Services. I do a Living Well with Cancer workshop, and I bring in guest speakers to talk about complementary therapies to cancer. We've also had therapists to come in and talk about how to deal with the stress and the anxiety of a cancer diagnosis. I have a peer-to-peer program where I match clients with someone who's already been experiencing it. And I also have a program that I can match caregivers. And what they do is they give each other just encouragement and support. And it's just always nice to hear, I've been there, I understand, this is how I got through it. We have several support groups. We have a program called CRC Cares About Kids to provide counseling for children whose parents have cancer. We do have somebody here in the office that is bilingual and speaks Spanish. So, if there's a Spanish-speaking family that needs assistance. We also have a boutique with wigs and hats and scarves to help those deal with when they're starting to have hair loss. For those women that have had a mastectomy, we have bras and prosthesis that we can help them to start to feel a little more like a woman again. We are here for our clients and their families. We're a warm, safe place. Our motto is no one should face cancer alone.
My name is Stephanie Powell. I'm a client services assistant here at the Cancer Resource Center. I'm active with our financial advocacy program that helps people who either are having trouble because they can't work, because they're sick, or they have big medical bills that they need help paying, or they need to find insurance to cover treatment that they need. We also have a small fund here that we can use to help people called the Angel Fund. You know, if someone needs their car repaired so they can get to their chemo appointment, we give them a couple $100 to get a brake job. Getting a cancer diagnosis is scary, and it's something that people often don't want to talk about. And then having financial trouble is something that's also scary that people don't want to talk about. So we wade into those uncomfortable waters and have those uncomfortable conversations and let people know that the earlier you address problems like that, the better. And we're here every step of the way. So another thing I help with is when people are first diagnosed, oftentimes they don't understand their disease or the treatment that they're going to go through. I have a background in science teaching, so something that I'm kind of good at doing is to make people feel more comfortable and get that education that takes away some of the fear.
Hi, my name is Donna Barrick. I'm a volunteer at the Cancer Resource Center. I also am a client, so I have dual purposes here. I've been coming to the Cancer Resource Center for about 4 years. It took me a while to come into the center. I don't know why, I was just nervous. But once I did, it's been a great experience. And that's why I decided to volunteer as well, to give back for all the years they've helped me, and they continue to help me. I've been coming to the noon group on Friday. It's a bunch of women that get together who have all different various forms of cancer. We get together for support. We do things outside as well. These friendships continue not just in the group here at CRC, but continue throughout. I also use their wig service here. They have a boutique, and what a lot of people don't realize is you can come here and get a wig for free. Right here we have an organization that works locally with people, one-to-one clients, and it's fantastic.
My name is Fran Spadafora Mansella, and I'm the Associate Director at the Cancer Resource Center. I think one of the most important things we offer is we listen to people. We don't have this prescribed expectation of what we think people should need or want when we connect with them, either here or at the hospital or out in the community. The first thing we want to do is listen, and then with the client, whether it's someone diagnosed with cancer or a loved one, a parent, a friend, then we try to help them. You've probably already heard our tagline, no one should face cancer alone, and we really believe that. We try to live that through how we approach our services to people. Though our office is in Ithaca, certainly we are of the Finger Lakes, and we're trying to serve people not just in Ithaca and Tompkins County, but the surrounding counties. You don't need an appointment. You don't need to fill out a registration form. We want to be there for you. We want to listen, and we want to help you in any way, whether it's one time or on an ongoing basis.
We hope that you've learned a little bit more about the Cancer Resource Center from this video. And even if you're not facing your own cancer diagnosis, you might be affected by it, either yourself or by a family member at some point in the future. And at that point, we hope that you remember the services that we have and the things that we offer. And you can reach out to us at any time for the support that you might need.